outside, but it's bright and lively in here. So good morning. My name is Pat Giles, and I'm currently the president of the Why Missing Foundation. Thank you, Barry. But I also have the dual pleasure of serving as a trustee for Alvernia University and previously served on the board and as board chair for Berks Community Health Center. So I am especially pleased to be able to be here this morning at this event and to welcome you to this day's announcement of a new partnership between these two community-based and focused organizations that will benefit the health and well-being of residents in and around downtown Reading and provide critical experiential learning opportunities for Alvernia students. As a current trustee for Alvernia, I've seen how critical hands-on experiential learning opportunities are for students, enabling them to apply the learning they receive in the classroom from our talented faculty to real-world experiences. At Berks Community Health Center, I witnessed firsthand how that organization has assisted the underserved in becoming healthier by ensuring all residents of Berks County have access to convenient, affordable, high-quality, comprehensive health care. Combining the missions, talents, and expertise of these two high-performing organizations will have a significant positive impact on our community. Joining us today are several board members from both organizations. Please identify yourselves, folks. I see you out there. Thank you for being here. I know that together we are proud to be involved in supporting the missions of both Alvernia and Berks Community Health Center in this collaborative effort. And we're excited about the impact this project will have on generations of students and residents of the city and Berks County for years to come. Now, as is customary at all Alvernia gatherings, I'll begin the event with a mission moment. I think many of you know Alvernia is a Franciscan institution founded by the Bernardine Franciscan Sisters who started their ministry right here in downtown Reading. The university's core values are rooted in the Franciscan tradition, and those core values are service, humility, peacemaking, contemplation, and collegiality. Values I think we all can agree we need more of. With today's announcement in mind, our mission moment will focus on the core value of peacemaking as it's described on the university website. We believe that peacemaking is striving for harmonious relations and developing an environment that is calm and serene, free from strife and contention. We believe that peacemaking in society should make it easy for all to obtain their material needs and to grow in their spiritual life. And we believe in a peaceful community of learning that resolves conflicts with fairness and justice. May we continue in our strive for peace in our communities. And it's now my pleasure to introduce Alvernia University President, Dr. Glynis Fitzgerald.
Thank you, Pat, for that very fitting mission moment. You know, if you've been with us for a few of these press conferences, you might think that we have a formula for it. We bring you a rainy day into a place that looks like it needs some love, and we talk about the future. And that's true. We've done this in grocery stores, in the insurance company across the street, and here in this historic building. But the one thing that really is our formula is our partnerships. And today we are so excited to talk about this new partnership with Berks Community Health Center. I'd like to give a special thanks to our faculty, staff, and students that are here with us today, and our partners, including Jahani Cepeda-Freyes, Barry Josiak, and Josh King representing David Zimmerman from the Commonwealth of Pennsylvania, and Mayor Eddie Moran from the City of Reading. You have each continued to help us work together in creative ways for our university and our community. Since we first announced our intentions to expand into the Reading campus into the downtown in late 2019, this initiative has sparked excitement and tangible change for our community. We stand here today in our latest campus expansion, just 2 short years from opening our doors across the street at the John R. Post Center. The addition of the American House to our Reading CollegeTowne campus provides another opportunity for the central component of our success with this initiative, community partnerships. Today, we announce this very exciting partnership. Together with Berks Community Health Center, we look forward to helping increase access to affordable health care in Reading, allowing residents through the delivery of coordinated, comprehensive services for all, regardless of their economic status. We're excited that our nursing, physician's associate, physical therapy, occupational therapy, social work, clinical counseling, and other social science students will work side by side with seasoned BCHC clinicians to serve those in need right here on Penn Street. This building will also hold so much more as we continue, including providing additional business incubator space for the Opaque Institute for Economic Development and Entrepreneurship, and space for local businesses and nonprofits, both established and new. We seek additional partners and support in this initiative, as only together can we change the lives of our students and our community members. Together, we have much to do to address some of the region's most significant issues, including increasing access and removing barriers to affordable education and healthcare, supporting local industry with skilled employees in healthcare, engineering, and social services, and building an entrepreneurial ecosystem that drives economic growth both along Penn Street and beyond. Today marks another milestone on our university's journey, and we look forward to continuing our mission-centric work here in Reading. Please join me in welcoming Mary Carbo, the President and CEO of our newest partner, Berks Community Health Center, to the podium.
I guess I'm short, right? Good morning. I stand here today proud of this collaboration with Alvernia University. It not only provides BCHC yet another opportunity to increase access to care for our most vulnerable populations, it also provides real-world clinical experience learning for Alvernia students. It is our hope at BCHC that those students recognize the importance of FQHC serves as a safety net provider for our underserved population. And we hope that some of the students will join our team as an employee upon completion of their studies to continue to make the difference in Berks County. In short, building the healthcare worker of tomorrow right here in Berks County and in our city. BCHC has a special relationship with our patients, addressing barriers to care, including lack of transportation or problems in navigating health systems to access needed services. We play an important role in encouraging patients to keep appointments, attend health education activities, and self-manage their medical conditions. In 11 short years, BCHC has grown to 5 locations throughout the city, including a mobile unit, to increase access to care for our medically underserved community. Our first location at 838 Penn Street is only 4 blocks from this future location, yet a true need exists for an additional site at this region of our city. We're nearly at capacity at 838 Penn Street, and data suggests that we are currently reaching out only 26.7% of the low-income population in zip code 19601, 19602. We have more work to do, and this is a collaboration that will assure success for all involved. In addition to traditional primary care services, BCHC will offer mental health services, nutrition, wellness education, financial literacy education, social services assistance, and warm handoff referrals. We plan to serve about 2,000 unduplicated individuals during the first year of operation. City of Reading residents are at risk of negative health outcomes due to elevated levels of poverty, traditionally marginalized populations, language and cultural barriers, and limited access to primary care services. This innovative collaboration will help BCHC in our quest to serve as many members of our community as we possibly can to improve the overall health of our community. I would like to welcome BCHC's board member, Nick Momentolo, to the podium to share a few words. He's been part of the Berks community board from the very beginning, so he's a lot of history. So welcome, Nick.
Well, good morning, everyone. It's a pleasure to be here. This journey in this collaboration actually began back in 2010 with the creation of the Berks Community Health Center and the establishment of the Board of Directors. I was very fortunate enough to serve, as you just heard, on that first board along with Pat Giles as one of the founding board members of BCHC. I've remained involved ever since, serving in a variety of capacities, including treasurer and chairman of the board. But since the beginning, I have been and I remain active today in the development of our strategic plan. The strategic plans of BCHC are developed jointly by board members and by BCHC senior leadership and assures that we're focused on our mission to provide high quality health care to anyone regardless of their ability to pay. Our strategic plans continue to serve as a roadmap to outline specific initiatives to further improve access to care, and we've heard about access to care in really everyone's remarks so far. When we first opened our doors in 2010, we did so right here on Penn Street, and we provided only primary care services. So even our very first strategic plan highlighted the need to increase access to more sites, as well as expanding the services that we provide. Today, as Mary mentioned, we now have 5 sites, and we provide comprehensive care that includes not only primary care, but OBGYN, pediatrics, behavioral health, dental, chiropractic care, podiatry, nutrition, and now we even have our own in-house pharmacy to make sure that patients get the medicines they so desperately need. All right, my fingers aren't as nimble as they should be. And certainly central to the tremendous growth we have experienced at BCHC is strategic partnerships. In fact, Alvernia, along with Reading Hospital and St. Joe's Hospital, and others, all collaborated to create BCHC back in 2010. And now we are Berks County's only FQHC in existence. Our subsequent partnerships primarily focused on expanding access for care and improving quality of care. So now, in some ways, we've come full circle with Alvernia. But the American House Initiative is a new type of collaboration for us. With this agreement, we will not only expand access to care to the many underserved residents in our city, but will also provide critical real-world training to future healthcare professionals. So on behalf of the BCHC Board of Directors, we're very excited to be working with Alvernia University, and we believe partnerships like this one are critical as we work toward our common goal of improving community health. I'd now like to welcome Alvernia's Dean of the Colleges of Health Sciences, Dr. Patricia Rieger.
Thank you, Nick, for the introduction, and thank you, Nick and Mary, for your partnership in this exciting new endeavor. Among the many roles I play as Dean of the College of Health Sciences, seeking partnerships that enhance our students' scholarly and professional pursuits and faculty research initiatives is among the most important. Upon my arrival at Alvernia just over a year ago, I was promptly introduced to the CollegeTowne initiative. It became evident that the initiative's primary focus during its second phase would be to meet the region's pressing demand for registered nurses, physician associates, physical and occupational therapists, and other skilled professionals in the healthcare field. The enthusiasm and optimism surrounding the potential impact of this initiative on our community ignited a palpable sense of engagement and energy among our students, faculty, and staff. As we near the conclusion of our post-center renovations on the second and third floors, there is much cause for excitement. We have relocated, expanded, and modernized the John and Karen Arnold School of Nursing with more than 25,000 square feet of classroom and lab facilities, complete with a state-of-the-art healthcare simulation center. The enhancements to our clinical space encompass various critical components such as multiple fundamental, skills, and health assessment labs, advanced patient simulation facilities, and a dedicated resuscitation quality intervention area. Additionally, these renovations provide expanded areas for faculty and staff offices, conferences and meeting rooms, faculty and student lounges, and areas for interprofessional education. The simulation labs will have associated control rooms for observing student techniques and procedures, and each will have a debriefing room. The simulation offers a wide range of benefits, including safety, realism, repetition, reflection, and feedback, and the development of critical skills. It will play a crucial role in preparing our students for the complexities of clinical practice and contributes to the overall quality of healthcare education. In the midst of this transformative phase marked by expansion, revitalization, and groundbreaking advancements, I want to underscore the importance of the pivotal role played by collaboration and partnership. Through this collaborative work with BCHC, our students gain practical experiences, learn how to effectively communicate with patients, experience meaningful interdisciplinary collaboration, and develop cultural competency, an essential skill for providing patient-centered care informed by our Franciscan values in a multicultural society. In turn, the Community Health Center provides valuable healthcare services to community residents who may otherwise not receive them, positively impacting the health and well-being of the Reading community. This partnership, coupled with our ongoing commitment to the heart of Reading, opens up exciting possibilities for the community and the university. It enables us to delve into the expansion of health science programs, unlock fresh academic opportunities, draw more students into the downtown area, establish a talent pipeline for the community, and generate novel employment prospects. So on behalf of the students, faculty, and staff of the College of Health Sciences, thank you for your partnership and for allowing us the opportunity to be a catalyst for healthy living for our community for generations to come. I would now like to welcome Reading Mayor Eddie Moran to the podium.
Good morning. There's a lot of people here. It's gloomy outside, but it's a beautiful celebration. Good morning.
Good morning.
Oops, I think I messed this up. It's truly an honor to be here today as your mayor, to share some truly exciting news that would undoubtedly impact the future of our beloved city. Today we gather here to celebrate a partnership that represents a big step towards our community's journey in prosperity, education, and well-being. Alvernia University and Berks Community Health Center have joined hands in a remarkable collaboration that would undoubtedly transform the landscape of our city and the lives of our residents, to say the least. Education is a cornerstone of any thriving community, and today's announcement shows their commitment to providing our youth with the opportunities they deserve and nothing less. Alvernia University, which has recently, hear this out, recently have been recognized once again as one of the best national universities for the second consecutive year, according to U.S. News and World Report. It's extending its reach into our city once again by establishing new pathways for our students to access world-class education and training. This partnership will provide local students with access to a wide range of academic programs and resources, opening doors to a brighter future for all. But it doesn't stop there. This collaboration with Berks Community Health Center, which I have an immense, incredible respect because I was there for the grand opening in 2010, demonstrate the dedication to the holistic well-being of our residents. Accessible healthcare is a fundamental right, folks. And through the partnership today, we aim to ensure that every member of our community have access to quality healthcare services, regardless of their background or circumstances. This initiative reflects our shared belief that good health is a crucial foundation upon which individuals can build successful and fulfilling lives. I think everyone in this room is aware that I was a board member for the Reading School District for 6 years. What you may not know is that I've also have been and still continue am a federally licensed health insurance agent. So the eds and meds is definitely something that is truly important to me. And I thank you both for that collaboration. Moreover, this partnership will foster academic growth and development within our city, which will create new jobs opportunities and stimulate local businesses, reaffirming Reading as a hub of innovation and progress. And it's all because of your collaboration. I would like to extend my deepest gratitude to both Alvernia University and Berks Community Health Center for their commitment to our city. Your dedication to improving the lives of our residents is truly commendable. And this partnership is a testament to the incredible potential we can unlock when we work together. In conclusion, today's announcement is a milestone in the history of our great city. It is a testament of our shared vision of a thriving, inclusive, and vibrant Reading. Together, we will continue to thrive for excellence in education, healthcare, and economic development here in the city of Reading. This partnership exemplifies our collective determination to make Reading a city that strives brightly and will do so for generations to come. So thank you once again. May this partnership be a source of inspiration and pride for us all. Have a wonderful day and congratulations.
So this concludes today's event. I thank you all for joining us. Also make sure I'd like to thank County Commissioners Rivera and Sahelnik for joining us as well. I know we need to give a shout out in the introduction. Wanted to make sure we did that. Any meeting members that have any additional questions for our speakers, we're going to take those questions right over here. You can provide those questions to me. And if you don't, thank you again for attending today's event.
Some of the principles that Mary and Dennis.
Yeah, want to do a group shot?
Yeah, but like in